Yes, it's recording now. Okay.
Okay.
So are we kind of backing away from this whole complete overhaul?
No, we're headed toward overhauling the entire system. I mean, we'd like to overhaul the entire Arkansas healthcare system. What we're not going to do is try to force it and take huge chunks all at once. Instead, we're going to focus on some key areas that look like they're really high value in terms of the volume, the cost, the promise for being able to make substantive reforms, and take those first. But then ultimately roll into other areas.
Is this a result of talking to the providers and stakeholder groups?
Yeah, we've had good conversation with the providers who've told us we ought to pick some priority areas, and frankly that we shouldn't just start with wellness and prevention, even though that's important. We really ought to look at the entire healthcare system and see in each area of the healthcare system, are there good opportunities for improvement.
Friendly discussions or heated discussions?
Well, they've been friendly discussions. I mean, they're animated discussions.
Yeah.
But we've been surprised at how many groups, and I mentioned a couple of them, the home care providers, the development disability providers, others who've said, you know, we've got some ideas on how some of this could work. So we're eager to have future discussions.
I talked to David Roten the other day, and he said, way too big. I mean, this is way too much.
Right.
I mean, Are you getting that too from people?
Well, we did. In fact, we met with the Medical Society and their executive board yesterday.
Okay.
And part of our discussion was, we've heard you, and that's why we're going to pick some particular priority areas and do that first, and not try to talk right now about exactly how the payment reform would work. And they seem much more over that. In fact, they said, we want to partner with you and figure out how to make this work in a reasonable way. So we had a very good discussion yesterday.
So as y'all, do we have a new timeline?
Well, the timeline's
just July, or is there?
Well, the timeline really hasn't changed in terms of we want to begin actual implementation in July of next year.
But
with
as
these
far
priority areas.
As far as the end game,
now,
way
the
out
end
there.
game, I mean, you know, we're looking at a year. Beyond that, it's kind of anybody's guess from there.
When we say high priority areas, what are, you know, I kind of got an idea listening to that, but what were the high priority areas?
Well, there were a number of them. We want to look at labor and delivery. For example, we have a very high C-section rate in some places that really not explained very well. We have a number of elective deliveries of babies before 39 weeks, and really the evidence is now that you really need to try to carry through 39 weeks before delivering if you can. So that, I mean, it's a specific example that we can kind of look at and say what works best. We want to make sure that seniors and people with disabilities really have the opportunities, and that our payment supports them living at home in the community when they can, and that when they need to be in a facility, that the payment supports that. So, I mean, those are just a couple of examples.
Well, how does the bundled care and episodic care, bundled payments and episodic care relate to C-sections?
Well, for C-sections, for example, right now we pay the doc, we pay the hospital. We can look at, for the doc and the hospital and the care afterwards, you know, the OB/GYN, the pediatrician, and say, for instance, do we want to pay for all of that as a bundle, both the prenatal care, the labor and delivery, and maybe a month of care afterwards, to try to make sure that everybody's working together, and change our payment structure somewhat also, and say, you know, we might pay more or less depending on whether you deliver kind of in an appropriate way.
So this more modest timeline, did it come about as a result of stakeholders saying, whoa, slow down a little bit, or?
Well, see, I wouldn't say it's more modest. I would just say we realize that you can only take on so much at once. But it's, I mean, the timeline from the start was to start implementation in July of next year, and that's still where we are.
I just got the impression that it was going to be bigger to begin with.
Well, that's probably right. I mean, the change is, instead of trying to take on even then it wasn't implemented everything in July of next year. It was still over the next year or so. But rather than trying to take on big chunks that could include a lot of little pieces, we said, let's pick some big priorities and start with those.